Medical Dialogues. I'm Mr. Zaman, and here's what I bring to you all from the world of medicine. Narrow opportunity to address a rare disease linked to autism and schizophrenia identified. Genes provide the blueprint for construction, but occasionally the blueprint is incomplete, connections aren't made, and circuits fail, sometimes long before the problem can be recognized, let alone fixed. That's the case with Di-George syndrome, also called 22q11.2 deletion syndrome, a genetic disorder affecting about 1 in 3,000 babies. It begins with the deletion of one of two copies of a small number of genes on human chromosome 22, whose cascading effects include cardiovascular problems, craniofacial developmental issues, and as children grow older, autism spectrum disorder and schizophrenia. By the time those symptoms are recognized, it's long past the opportunity for a medical intervention. Researchers show how two different types of immune cells help 2 billion people keep tuberculosis in check. The key feature of tuberculosis infection in humans is the formation of granulomas or clusters of immune cells in the lungs that contain the infection. These granulomas contain B cells, all-purpose immune cells that perform a variety of functions from producing antibodies to regulating the activity of other cells. For years, researchers assumed that these B cells must be performing a specific direct function in the granulomas to control TB infection. But in a new study, scientists from the University of Chicago and Washington University in St. Louis show that these B cells are actually directing reinforcements to help. The team eliminated different expected B cell functions one by one in animal models of TB to narrow down the possibilities for which components prevented progression of disease. Nothing seemed to make a difference whether removing plasma cells that produce antibodies or knocking out other B cell functions that produce immune signaling molecules. In addition to the results in mice, the team saw the same results when they completely deleted B cells in non-human primate models. Lorlatinib is safe and effective for patients with ALK-driven relapsed or refractory high-risk neuroblastoma, research shows. In a significant step for the treatment of neuroblastoma, an international group of researchers led by Children's Hospital of Philadelphia, Winship Cancer Institute of Emory University, and the New Approaches to Neuroblastoma Therapy or NANT consortium has shown that the targeted therapy Lorlatinib is safe and effective in treating high-risk neuroblastoma. The findings have led to a major amendment in a phase 2 clinical trial, which has incorporated Lorlatinib for newly diagnosed ALK-driven high-risk neuroblastoma, as well as a planned amendment to the European phase 3 trial in collab with the International Society of Pediatric Oncology European Neuroblastoma. The results of the study are exciting for patients with high-risk neuroblastoma whose tumors have a genetic alteration in the ALK gene and who have lacked effective targeted treatment options for this often lethal cancer, said senior study author Yael P. Moose. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.